Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. As always, I'm Michael Swartz, and with me today, a guest I'm very excited about. His name's Larrie Greenberg, and Larrie spent 46 years practicing medicine with 44 years in academic medicine, and specifically has a very unique experience related to the resources or lack thereof that surround the physician's retirement journey. And so, with that, Larrie, thank you for joining us today on the Health and Wellness Podcast. It's a pleasure to have you here.
My pleasure. Thanks so much for having me.
Absolutely. And we came together through Rob McGregor, who's another contributor to the Health and Wellness platform. He located your white paper that you published on physician retirement, but the message in the white paper, I'll let you kind of tell the story here. I guess what have you learned in researching physician retirement readiness?
Well, yeah, it was based on personal experience. So I should say when they retired me, I never
Okay.
retired. When the university retired me, of course, I met with people in human resources. That's what happens in academic medicine. In private practice, unless you're associated with a big organization like Kaiser or whatever, you probably don't have access to someone like that. So the person in HR said, I assume you have a profit sharing plan, and I'm assuming you're going on Medicare. That was it. I'm thinking, geez, it seems like I need to know more than that about retirement. And that triggered looking at the literature in terms of, so what does the literature say about physician retirement, especially around, I looked at it as academic physicians in academic health centers because that's what I am, and started looking at that from an academic point of view.
And what did you find? Because I know you looked into this with a couple other academic physicians as well. What did you guys find?
Well, Michael, there is no model out there. That's the problem, and it's woefully pitiful because as part of one's career is the retirement process, whether you're in private practice or whether you're in academics. It's a continuum. It's not like, oh, I stopped my job, so now it's all over. The question is where do I go next? So what I found is there is information in the literature about mostly academic physicians, some in private practice, and there are specific, uh, I would say, vectors that impact on the retirement process that all physicians need to consider. And that was not part of my process. So that's how I got down this road.
Well, you mentioned the framework, I think, or at least the structure of a physician's career, in that whether once you decide to become a physician, so much of your professional trajectory is laid out, except for this end of career and retirement transitions. You mentioned this continuum of the career, and it's absolutely a part of it, and yet really solutions haven't been developed for it yet, right? We've got education, high school, let's call it undergraduate degree, master's, doctorate, residency, potentially fellowship, and even the course of the career. That is very much defined by external environmental factors. The education is defined for you, your career is defined for you. But this retirement transition, there's no model, there's no framework, I've heard it called a blank slate. And so when HR comes in and says, well, you've got your 401k and you've got some health insurance, thanks for the 44 years.
Adios. They didn't even say thanks.
Well, maybe we'll add that into part of the framework is asking for a thank you. But I guess how does that leave you when you're facing that? Where does that leave you?
Well, for me, Michael, it wasn't an issue because in researching the literature, I was very aware of some of the vectors and impactors that really affect retirement. Let me give you a quick example.
Sure.
Uh, my wife was totally amazed when I was talking about some of the stuff I was finding uh, around academic physicians, one being financial. Um, the literature would say about academic physicians is there is a significant number of academic physicians who do not understand how much money they need to retire, and they don't understand their obligations once retirement occurs. As an example, You could be the sandwich generation. You
Mm.
could have elderly parents. You could have young adult children, both of whom need your financial support. And the question is, have you looked at how much money you're going to need in order to meet those obligations? And what my wife again was surprised at, she says, that's impossible. Physicians have to know how much money they have and how much money they need. The literature would say that's not correct. I don't know about private practice. I don't know about private practice, but I'm guessing there probably are some in private practice who also don't have a good handle on that because for many physicians, or maybe I should say some, money is not the bottom line. The bottom line is their passion to help people, to prevent disease, to help disease, et cetera. And they don't pay as much attention to the finances. But that's one example of one of the factors that impact on the whole process.
Well, yeah, and we talk about that a lot with physicians because we're a younger practice ourselves. Me and my business partner are both in our mid-30s. But even financial advisors and financial planners who hold themselves out, who have worked with physicians throughout the course of their career, have done accumulation planning, but retirement planning in and of itself, it's a very unique equation, right? There's Social Security timing, there's required minimum distributions, there's investment planning and allocation, and it really can be as complex as you'd like to make it, as your understanding allows for. And at the end of the day, does my cash flow work? Yes or no? That's the question to answer for retirement. But the approach that you take to that and understanding that level of complexity, your full-time job as a physician was not to know that. And over the course of your career, things have been added in like the 401k, like the Roth IRA, where kind of in the background, on the periphery of what you're doing professionally, all this complexity in the financial world has developed. So when you say, being a physician is not about the money. Well, earning money, even so, is very different than managing money and creating retirement income from those assets that you've saved into, like you mentioned, the 401k. And so, what may be a shock to other folks is no, you had a very demanding professional and relational career where you're dealing with people, helping heal them. The money wasn't top of mind. And now you're saying when physicians approach retirement, that's a very big topic to breach.
Yeah, and let me just say that, early on, I never made a lot of money, but I always made enough to, you know, support my family the way I did. Um, but I invested very wisely, and along the way, I decided that I needed help. I didn't know how much I needed. How much did I have? How much did I need? And that was the time, 1989. So early in my career, 17 years, well, that's midway into my career, maybe. Um, I said to my wife, we need a financial planner. We need somebody to look at our assets, what we have, where we need to go, and how to invest wisely. We had already done very well. I attribute some of that to luck. I also attribute some of that to making sure that I put money in every year, which the university matched, uh, to save. But I felt early on I needed a financial planner. It was the best move I ever made because they have been, well, how many years now? It's 36 years. They have been very helpful in helping us determine our future and how we're going to give and how we have given money away prospectively and how it's going to happen after our death. So uh, yeah, that was a groundbreaker for us. I must say. I'm not tooting your horn by any means because I don't know anything about you, but in terms of your financial planning stuff. But I can just say that having that money in a pot within the medical school slash university was not enough for us because I just didn't know what our needs were.
Yeah. And having that clarity really provides authority then to come back and say, okay, with the finances taken care of, what do I want to do personally? And so it gave you maybe some of that freedom to live more aligned, to give, some of that money away and really act in alignment with those values. And so what's interesting there, you bring up a good point because there's a book, Life After Medicine by Alan Rodberg, and he talks about retirement readiness specifically for physicians. And the number one advice of pre-retiree physicians is to plan your finances. And interestingly enough, after interviewing retired physicians, the number one piece of advice was now that I'm in retirement, plan your time became the pinnacle advice, not money. And so, in anticipation of retirement, checking the box of the finances is a vitally important piece. As a certified financial planner, we do fee only comprehensive financial planning, which basically means unbiased advice, conflict free, or as conflict free as a financial planner can be. And so, yes, finding someone to help you plan your finances is a critical part of the career trajectory. But what nobody has really solved yet is that problem of the personal retirement plan. The financial retirement plan can be written. So when you say you're not tooting my own horn, absolutely. Any good qualified certified financial planner should be able to build you a pretty strong financial plan to transition into retirement, which you benefited from the sounds of it. And so then the next question is who's helping you build that personal retirement plan?
Well,
And that's
yeah.
where you went. That doesn't exist.
Yeah, so the issue is yeah, that's another thing we found in the literature, which again, even though we were looking at academic physicians, this applies to those in practice. There's not a difference there, and that is, I'm going to bring up a couple factors. One is what do you see yourself doing post-retirement? And let me break this down. As an academic physician, and less so as a person in practice, but there are opportunities for people in practice. They just have to look. As an academic physician, am I going to stay connected? So am I going to continue something in medicine? Would I do it on a part-time basis, which would have to be negotiated with the chair of the department? Would I do it as a volunteer? That also has to be negotiated and it's a two-way street. You just don't say, hey, I'm here to volunteer. It's got to be a two-way street. So the ground rules are set and both sides benefit. It's not enough for you just to say, oh, I'll volunteer and then have the other side be supportive of your volunteering. Am I going to cut the cord totally? So am I not going to stay connected to medicine at all? What is my health like? What is my health like? Am I able to still perform at the same psychomotor skill level as a surgeon, as someone who does procedures? And how about my cognitive abilities? Am I still there? Will somebody tell me when I don't recognize it that maybe it's time to step back a little bit? So staying connected is one issue, and how or not. And if I'm not going to stay connected, I just had somebody call me, a longtime person in private practice, and he said, I'm not sure what I'm going to do with my life. I'm ready to retire." Someone I mentored as a resident early on, I said to him, well, there are lots of opportunities. What is your passion? What do you want to do? He never even thought about staying connected, like maybe observing residents do histories and physical exams, observing students, helping and using his wisdom in that. And I said, if that's not where how you want to stay connected, then you've got to look for other things. Like what are your hobbies? Some physicians have none. Their career has been their whole life. Some have no hobbies. But before the pandemic, I had already had a I already had a interview scheduled with one of the not the Smithsonian, but one of the major uh, governmental agencies, Library of Congress. When the pandemic hit, it was all wiped out. I was going to interview there. I sent my application into the Holocaust Museum. I said, I'm a teacher. I know a little bit about history. I'd be helpful there. So those are the kind of options you have if it's going to be away from medicine. But those things have to be thought out because I want to tell you, my worst days, and they're not very often, is when I wake up and there's nothing on my calendar to do. I don't know how to. I relax. I relax, but not for a whole day.
Yeah, I've heard several physicians say, one solution to that is taking advantage of the sabbatical or even extended time off. And
Mm.
unfortunately, the way contracts are structured right now, it might be 90 or 180 days before you can ask for time off or a sabbatical. And so, what do you do when you don't have something to do? I think that's the question you're asking. And how do you, I think there's a step before that. How do you figure out what you want to do when so much of your career defines, to your point, your career can be your identity, it can be your purpose, and it can be a platform to live out your values of being of service or teaching or helping others solving problems. If you have all these skill sets and you have an identity in your career and your purpose is provided by it, how do you take that, values, identity, purpose, and really take the VIP out of each word and make that turn that into a VIP retirement for yourself? What is it that I'm doing with the health that I have, with the skill set that I have, with the value that I have to bring? How do I make that value aligned so that I have a new identity and a new purpose beyond practicing medicine? And I don't think that's an easy problem to solve. And as you mentioned, it takes several years because whether you like it or not, I did have a physician who told me I dropped to a point 0.8 before I retired. And that let me know what a 3-day weekend would look like. Not 7 days off, 52 weeks a year, just a 3-day weekend. It was a massive wake-up call to what one day without something to do looks like. You can't read all the books. You can read the newspaper for a half hour, an hour in the morning. You can drink your coffee, 9:30, 10 a.m., nothing else to do the rest of the day. It can be some of your worst days having nothing to do because the honeymoon period wears off. And then you're kind of left with well, who am I and what am I doing here with my life? So it sounds like you did that work. You got your applications out. You knew what mattered to you. I guess, did that help your retirement transition?
Yeah, and I guess to follow up with what you were saying, I mean, the analogy I use is, I'm sure this applies to practice. I mean, you're going 90 or 100 miles an hour,
Hmm.
and then retirement, you're going 10 miles an hour. I mean, you drop immediately once you sign those papers or whatever you have to do to retire to exit your job. All of a sudden, you're going 10 miles an hour. Somehow, you need to ratchet that up a bit. It doesn't mean you're going 90 again, although my wife would say I'm still going 90, but at 85 years of age. But yeah, you want to ratchet that up some so that you're doing something. So if you're not doing something every day, you have some planned activities a number of days a week. And I would just yeah, there's so much stuff going through my mind. I would just add to this. One of the other vectors we found, which dovetails with what we're talking about, is who are your support systems?
Yeah.
So at my age, I'm seeing friends sick and I'm seeing friends dying. Some people, when they retire, their friends have moved away to be closer to their children. So where are the support systems that you're going to need when you make this big move? Family no longer is nuclear family is no longer in the same, everybody in the same community. The kids go away to college, they move away. Again, friends move away to be close to their children or are sick and dying. So the support systems are important because, if you want to go out and play golf, with a friend, you want to know that that friend is there around. So those are also issues that help fill that space that you have every day or so many days a week that, help you fill your time, which I think is important. We garden, we go to theater, we do a little bit of traveling, less so than we used to. So we do a lot of other things, but those are not day-to-day necessarily activities. Some are. The gardening tends to go that route, but a lot of the other stuff doesn't. So yeah, I would just also say, Michael, there's a great book out there. I think it's 20 years old. It's written by Gene Cohen, who unfortunately died prematurely. He was with the National Institute of Mental Health and then came to George Washington, where I'm a professor emeritus um, in pediatrics, and started the aging department there. His book is called uh, The Aging Mind. It's 2005. Somebody recommended it to me. I read the book, and boy, light bulbs went off. It kind of explained what I was doing and why. And Cohn's research still holds today, even though it's 20 years old and it's been built upon. So there's a lot more research out there in the last 20 years. But it talks about older adults like us that are trying to figure out the whole retirement issue and what we're doing. The book is an easy read. It also goes into some of the neurology, which is easy to understand of what happens to your brain when you're older, in a positive sense, and explains a lot of what I was doing with what he would call unfinished business.
Hmm.
So I had a lot of unfinished business, some in practice, and some in academics might say, I don't have any unfinished business. I'm done. I'm finished. I'm glad my career's over. Hmm.
But what a blessing, or what a value that would bring to know that consciously. I mean, even to conjure that into the conscious contemplation for to say, hey, either I do or do not have that unfinished business. And what do I need to do here towards the end of my career to prepare for that transition?
Right. It's kind of a self-fulfillment thing.
Yeah.
If you can bring that to the forefront and say, what did I not do that I wish I had? Some of the stuff's still possible. So, like this pediatrician in practice I spoke to, I said, you have so much experience under your belt. You would be great to observe how residents interact with patients. And he said, well, how would I do that? And I said, well, you have to contact people at the medical center and see if they're willing to have you come on board. You try it and make sure it's, like I said, a two-way street. They're supportive and see if that works out. If it doesn't work out, you tried it. End of story.
And that's a way to kind of refurbish the tools
Yes.
that you developed over the course of career to not just truncate and completely put a guillotine down on your skills and values and how you can show up in the world and give back. I mean, it is value aligned, and I've heard so many physicians say, I came to serve. And so when that career ends, how will you continue to serve? And so a phenomenal solution for that individual. Absolutely. And Larry, maybe as a final talking point here, you really brought up a good point regarding social networks and how, especially in private practice and the non-for-profit, healthcare systems, I see it so often that physicians' entire social networks, or majority, is through the system itself. And maybe it was for you in academics, maybe it wasn't, but what advice would you give to someone whose literal entire social network is either between patients, coworkers, or colleagues?
Yeah, that's a good question, Michael. I think, in practice, it would seem to me that things are very insular. If you're in a private practice, and let's say you're in a group practice
Sure.
with two or three other physicians, I think that's where it's limited. I think your networking outside that practice doesn't happen very often because of time constraints, because of trying to divide your time into, you know, I need my personal space. I'm not about to use that time to now. So I think it's very insular. That's my impression. In academics, it's much more generalized than that because we have established over our careers contacts with colleagues all over the country. I still keep in touch with people that I value and that I worked with over time. I like to hear from them. I send them stuff about me, like when I just wrote my latest book. I send them a little thing about that and about my family, and so academics gives you that opportunity if you choose to do that. If you choose to do that. And, that was what I thought was important. The networking piece is really also part of the retirement process in terms of connections,
Hmm.
social connections and not being isolated. Yeah. No reason to
Well,
be no reason to be isolated.
well, yeah, and there's plenty of research coming out that really that isolation is leading to a lot of unfavorable outcomes in retirement. And so, what can you do in the final years of your career? Yeah, you touched on it, but it's a way of taking some of those relationships into retirement with you and creating some new ones on quote on the other side. And so once you're into retirement, um, the former CEO of the healthcare system here really hit the nail on the head. He said some relationships will become thin pen lines or even get worn away down to basically pencil lines over the course of time. But what you get to do in retirement is pick which ones you want to take a big black Sharpie and just drag that over your relationship, rekindle old friendships. I mean, go back through the relationships that have been a part of your life and rebuild them, revisit them. It can be powerful. And it sounds like that's something that you've observed or seen as a valuable part of the retirement journey as well.
Yeah, yeah, that can be very powerful. I agree with you, and can help that social networking in terms of avoiding depression and
Hmm.
mental health issues, which can happen to people retiring. Because again, my analogy of going 90 miles an hour and slowing down to 10 is just not accepted well by some, and they don't know how to handle that. So
Yeah.
that does lead to depression, isolation, and sometimes premature morbidity, mortality.
Hmm.
Yeah.
And we're seeing that whether that's health, kind of external health events or self-induced. And so it's a very real issue. I mean, physician suicide is talked about in the career as a major topic, but the statistics are out there and they're not in favor of mental health and stability. They're saying especially post-COVID, whether it's alcohol dependency, drug overdosing, and especially for single males. I mean, really, aging males are the ones at highest risk for overdose or alcohol-induced or just self-induced suicide. And so, a very real issue to bring up here and to say that this is the real impetus behind having a smooth transition into retirement, having the social networks, the personal conviction, the really engaging things that remind us we have a sense of purpose, we have value outside of our career. Because my hope in the whole health and wellness journey is to help provide not only resources but hope that there is a way to do this, even though the framework may not be here yet. I mean, we have a whole coaching arc that transitions folks from their career in the final 5 years and into the first 5 years of their retirement. That's what people will need. Sometimes it takes years just to develop that vision and then another decade to let it unroll. So we're looking at 5 to 10 years ahead of retirement, getting these things in order and getting started working on them to avoid the alternative, which is a potential retirement cliff, and then some of these really unfortunate outcomes. Because to your point, HR won't be doing it for you.
No, not currently. And I know we're out of time, but we didn't mention, you touched on it. We didn't mention the issue of burnout
Yeah,
prospectively. And
yeah.
if somebody is burning out and they realize it, that's the point where they need coaching or they need someone to help them either redirect their career into something that would be more beneficial to them and less stressful, or their current career, they need to figure out how to redo that. And that's also an important issue. There's no reason for burnout. That also leads to unfortunate outcomes, suicide, depression, et cetera. We didn't have time to touch on that, but that's something prospectively for sure.
Yeah, and in future conversation, I think it'd be valuable to touch on Larry. And so for today, just kind of looking back at the recap, um, very grateful that you took the time to look into it on your own personal retirement journey for what literature or framework would be out there, and really identifying these vectors that affect the retirement transition for a physician, whether it's finances, relationships, or purpose, and then doing some of that proactive work so that your retirement, you can still be going 90 miles an hour. See your point.
Probably 75, but my wife might say I'm going 90.
Fair, fair enough. So, yeah, thank you, Larry, for your time today. I look forward to future conversations with you as well. Your wealth of information on this topic.
Thanks, Michael.
All right, take
Take
care.
care. Bye.
Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.